Okay. Hello. I'm going to have Cindy not share her screen so I can share my screen. Thank you. So can you all see my screen? Okay. I think I'm going to get started here. Give me a moment to get going. Okay. Hello, I'm Cheryl Baderman. I'm the manager of the Area Agency on Aging, Dane County Department of Human Services. This is the public hearing for the 2022-2024 Dane County Aging Plan. It is being recorded and a copy will be posted on the AAA website. County aging units are required by the Federal Older Americans Act to provide supportive services for older adults by preparing and developing an aging plan approved by the state. As we finalize the process of writing the next 3-year plan, which will guide our work for 2022 to 2024, we need the help of our valuable community organizations and partners working with older adults, and that's you. We developed a draft aging plan that will guide decision-making at all levels of our organization and clearly signal our intent to focus areas and goals pertaining to services for older adults in Dane County. Okay, here we go. To do this, your input will ensure inclusive voices are brought to bear on this planning process and help us to thoughtfully consider the viewpoints, the needs, and the desires of all older adults. Our presentation will provide the past, present, and future of the required process and final plan. The draft plan was posted on the AAA website, and the link is indicated here. So how did we get here? The Bureau of Aging and Disability Resource State Office on Aging distributed the final instructions for the plan in May. AAA staff immediately created a timeline to ensure all requirements and deadlines would be met. We then compiled a listing of Dane County Aging Network contacts, AAA board and standing committee chairs, the ADRC, the governing board chair, senior focal points and senior centers, Dane County agencies working with older adults of color and identify as LGBTQIA+, AAA providers, and county staff who work with older adults. These 77 contacts were invited to serve on the Aging Plan Advisory Council. 2 meetings were held via Zoom, and communication was limited to emails and postings on the AAA website. AAA staff worked closely with Dane County Department of Human Services Program Analyst Betsy Strawn to create, conduct, and analyze a comprehensive survey that was offered online using small focus groups and via one-on-one. The survey and results are posted on the AAA website. Using the results of the survey and adding data obtained through customer satisfaction surveys conducted within the past year, AAA staff drafted goals, which will be discussed later. Throughout the summer and late into the fall, AAA staff drafted the remaining required sections of the plan. So What is the plan? The first part is the executive summary, which captures the essential points of the plan by addressing mission, vision, values of the aging unit, what the aging unit provides for the community, what was learned through community engagement, the current challenges and needs of the community, and the long path vision of the aging unit. This section also describes the leadership of the aging unit to include the aging unit director and board chair. The context sets the stage for the aging plan and describes the issues to be addressed in the rest of the document. The context conveys a clear understanding of the current and future service and support needs of the county's older adults and the issues, challenges, and opportunities facing the aging unit. The aging plan context answers these questions. What are the age trends for older adults in the county? What needs have been identified through community engagement or other analysis? How do the needs differ across race and ethnic groups, rural and urban, income levels, and generations? How's the aging network organized to support older adults? What are the critical issues and future implications for aging services in the community? And what are the resources and partnerships? The community involvement in the development of the plan. This section of the plan provides evidence of a commitment by the aging unit to engage with the public in the development of the aging plan. A cornerstone of the Older Americans Act is that older adults have full participation in the planning and operation of community-based services. People in the community must be afforded opportunities to be part of the planning, express their ideas and concerns about current supports and services, and state their needs for the future. The community engagement section describes the methods used to collect the information from community members, specifies how engaging community members, the advisory council, and the AAA board influenced and informed plan development, and includes supporting documentation that depict input collected from community members. This section also includes requirements of this public hearing. And the last section is the organization, structure, and leadership of the aging unit, and it includes the primary contact to respond to questions about the aging plan. And in here, I did insert Angela Velasquez due to my pending retirement in early February, and the organizational chart of the aging unit. The staff of the aging unit, how we AAA coordinate with the ADRCs, and the role and the membership of all of our wonderful board and standing committees and aging plan advisory council. The aging unit is required to submit an annual budget to the state with the approved final plan by the 15th of January 2022. It will also be posted on the AAA website after this date. The verification of intent is a signed document to show that county government has approved the plan and is committed to carry out the plan. The assurances of compliance are signed documents that verify the aging unit has reviewed and will comply with the applicable federal and state laws and regulations, which include the Civil Rights Act, Federal Fair Labor Standards Act, the Hatch Act, Older Americans Act, Wisconsin Elders Act, and the Uniform Relocation and Real Property Acquisitions Act. And the last section of the plan, which is 77 pages without all the appendices, are documents that support the aging plan. A major section of the plan describes both the goals and supporting measurable activities the aging unit will do during the planning period of 2022 to 2024. For this 3-year plan, goals are required for each of the 4 funded Older Americans Act Title III programs, which include Title IIIB is supportive services, in which we have 2 goals that are address transportation options and services. Title IIIC, which is the nutrition program, which we also have 2 goals, which include nutrition consumer choice and malnutrition. And Title IIID, health promotion, in which we have 1 goal, which includes the Latinx evidence-based healthy aging classes, and Title IIIE, which covers caregiver support, which we have 1 goal that addresses caregivers of color. The state also added 1 goal to increase local aging network participants' knowledge and skills related to advocacy, which we do have 1 goal having to do with training and representation. And lastly, counties may choose to develop goals to address a local priority, which we have included 1 goal, which addresses people of color and LGBTQIA+ older adults. In addition, these goals are required to address each of the following. 1 must address an emerging need, a quality issue, or a gap in services, in which we have 1 goal. 1 must enhance ongoing community engagement to build a sense of ownership and commitment. We have 2 goals that cover this. 1 must address progress towards person-centered services, maximizing consumer control and choice. We have 3 goals addressing this, and 1 must address a barrier to racial program participants, Dane County Aging Network stakeholders, older adults who are people of color or identify as LGBTQIA+, Aging Plan Advisory Council, and the AAA board and standing committees. The goals will result in quality program improvements and introduce vital new services to enable older adults to live safely and independently in their own homes. So what's next? AAA staff will collect feedback received from this public hearing and through the AAA website. Comments, questions, and recommended changes will be listed in the aging plan and on our website. Recommended changes will be presented with the draft aging plan for final approval at the AAA board meeting on the 3rd of January at 3:45 p.m. via Zoom. The approved and signed plan will then be submitted to the state by the 15th of January. Now here's your opportunity to ask questions, make comments, or recommend changes to the plan. We have until 1 p.m. If time runs out, we still have ways to provide feedback by email or by writing at the address listed on this page. So I'd like to open this now up to anyone who would like to make a comment. There are several ways you can make a comment. One is through the chat room. And the other way is to raise your hand, which you just need to do by going down and figure out how to raise my hand here.
It's in the more section at the bottom of your screen.
Ah, thank you, Angela. Yeah, you could raise your hand that way, or you can just do it the old-fashioned way and just wave your hand manually and get our attention. So does anybody want to start out by asking questions or making any comments about the plan? Everybody's happy, huh?
Yeah, I'll just give a thank you for all the hard work that went into it. It's really comprehensive and well thought out. So I appreciate that.
Thank you, Anna. Anybody else have any questions, comments? Criticisms? We'll take those too. Yes, Katie.
Everybody. This is more of just a question, not a criticism. And I guess I'm more just curious. One of the things that we had heard, or I've heard from folks working with seniors, is that particularly in the after effects of the pandemic and in the ongoing pandemic, there's a real isolation and there's mental health challenges, et cetera. And I don't necessarily see any of that addressed here, unless possibly under the umbrella of senior advocacy training. Is that something that the AAA is thinking about for potentially future aging plans, anything like that?
I know that we have a section in the context. I don't know exactly what page it's on, but we do address it there. Angela, would you?
Sorry if I missed it. I'm sorry, I'm looking at the plan. I'm
It's
sorry if I
okay.
missed it.
It's okay, but Angela would also like to respond.
Hi, Katie, and thank you for your comment. There, I think what is important to state up front is that this plan includes 8 goals that are specific to what we've heard this year and that we're going to be working on over the next 3 years. It means we're going to do more. We currently have social isolating, mental health services for older adults or program for older adults, inclusion and diversity programs for activities and participation that already exist. There are many, none of the programs that we're doing now to combat social isolation are going away. And in fact, we continually are increasing the level of participation, whether it's via phone, via Zoom type of activities. All of our senior focal points are now open and providing activity. That doesn't mean that there are not socially isolated and lonely older adults residing in their own homes. And we continue to try and provide outreach to those individuals. So I think the closest thing in this plan, though, that was considered is under the transportation options. There are many older adults who are not currently participating in aging services or social activities, et cetera. And it's largely on either on the rural side or in those living alone that are no longer able to drive, that the need for on-demand individual transportation options needs to happen. Whether it's to go play bridge at a neighbor's house 3 weeks from now or one Thursday of every month, that they have a choice and that they can choose via transportation to be able to get there. That is probably our broadest goal, our biggest goal that is very future forward. We're going to need more and more of that. But I guess my comment, Katie, we are currently doing and have a lot of options available for older adults. And we are currently, it is only 2 years ago, I think we received the funding, correct me if I'm wrong, Cheryl, to launch the mental health program for specifically older adults. So I hope does that answer your question, Katie, or your concerns?
Yeah, absolutely. I was just curious. Y'all are doing such a fantastic job. And I just didn't, as I was looking through this again before the meeting, didn't notice any of that directly in the plan. So I was just curious because I know it's come up in the Dane County Food Access Network meetings. It's been, conversations we've had with, other senior partners. So I know it's certainly in the air. So I was, certainly not meant as a criticism, just curious. Thank you.
Not at all. Thank you for your comment.
I should make sure everyone knows who Angela is. She's our aging program specialist. She's my right-hand person that does everything that I pretty much don't want to do. So she does all of the budget. She does all of the nutrition, the caregiver support programs. She's got her fingers on everything. So. Okay, we have a couple of people coming up. I know that Ted's got his hand up, Richard, and also Melissa has a comment. So let's start with Ted.
Well, my comment is brief, and I also sent some written comments to Cheryl not too long ago. My name's Ted Bunk, and I'm on the AAA board and on the Legislative Advocacy Subcommittee. And the reason I raised my hand this morning, even though I already sent in some written comments, was just how struck I was with what went into developing this plan. The goals are important, and they really speak for themselves, I think. But what really struck me was just how much went into obtaining those goals. A lot of input, a lot of diversity, a lot of thought, a lot of different stakeholders. And besides the goals themselves being very important, I think it's remarkable that, especially during COVID and all the challenges that had to have come up, that this kind of input is represented in the plan. So my comment now is just thanks to everybody and appreciation expressed on behalf of all of us seniors on what went into making this plan represent as many of us as it does. Thank you.
And thank you, Ted, for your continued support by serving as a volunteer on the board and our committees.
My pleasure.
Richard, would you like to go next?
Yes, thank you, Cheryl, and thank you to your staff for providing this opportunity for comment. I serve as the president of the board of Rsvp of Dane County, and I'm glad the issue of transportation was brought up this early. You know, Rsvp is celebrating its 50th anniversary this year or next year, and I'm sure you're all aware of the services that they provide. I'm specifically very involved in the transportation area of Rsvp. I served on the board for 11 years now. Prior to that, I spent 13 years as a coordinator and driver for Rsvp. So I'm very interested in the challenges that are being faced right now with isolation, lack of transportation by seniors, the disappointment in not being able to get to necessary appointments and other matters. I follow very closely the state and the national statistics on nonprofits that provide transportation for seniors, and I'm very troubled, and you may have seen some of these figures too, but nationwide nonprofit transportation services lost over 29% of their drivers, and this continues to be a great problem. The key to providing a successful transportation program for seniors comes in recruiting, being able to provide a situation and an atmosphere that benefits not only the driver, but the person that the senior person that the person is interacting with while they're on the transportation trip. You know, I commend you very highly for looking into these various areas, and I would like to comment that the biggest failing in this whole area for our seniors is if we cannot feed back the necessary help for transportation, the situation just gets worse. And the complications that COVID have given us and other services countywide remains a big challenge. So I'm glad to hear that that's a part of your plan here, and I commend you for what you're doing. Thank you for the time you're giving me to speak.
Thank you, Richard, and thank you for also volunteering your time and serving on the board with Rsvp. We contract for many services with Rsvp, and I'm very, very appreciative of Margie Zutter and her staff over there. In fact, they just, Margie and a couple members of her staff presented, gave us an update at our AAA Access Committee meeting this past week, I believe, giving us, telling us what everyone's been up to. But getting back to what you were saying, transportation has been the number one, right next to affordable housing for older adults. It's been a big need in the community, and that's why we have chosen to go after this lofty goal that we've included. It's going to be very expensive, but it's we feel a very much needed goal in order to keep our older adults remaining and living in their home as long as possible. So thank you. Okay, and I believe our chair of our AAA board, Supervisor Melissa Radcliffe, has a question or a comment.
Thank you, Cheryl. And thank you everybody for all the comments and questions today. It's looking at the plan. I mean, it's very extensive and there's a lot of needs for our older adults. And I think this is a great tool that we can use going forward. I'm just wondering if we've taken any steps towards implementing towards the goals that are listed, or have we thought of ways to be able to work towards the goals? And I know it hasn't been approved yet, but they're all important things that are in the plan. And so I'm just wondering if we have already started some ideas along those lines, and how the board can help support these initiatives going forward.
So for each of the goals, we and associated with each of the goals that will be included in the plan. And I'm sure that we will be relying very heavily on our board members and our committee members and everyone really who's here at this meeting, our aging network, to ensure that we're able to achieve these goals. Some of the goals seem a little lofty, as they say. So it will require a lot of effort to go into it. Angela, did you want to make a comment?
I would just state for Melissa's benefit and those on this call or on this attending today, that we have begun efforts in several of the areas. For example, under advocacy and community engagement, we began, I believe, in October, having the coffee talks out at the senior centers, the focal points, with older adults about what they are currently thinking, how they're feeling, what could we be doing, what aren't they aware of that we do, etc. And I have to say, those have been extremely engaging. The thoughts that they put forth are very important to hear. And I believe we just continue doing that throughout the next 2 years or 3 years. The other area, which you have been instrumental in, was getting us hooked up with Olivia Perry. I believe that is her name. Whereby we can begin to make them aware, make Dane County and the city of Madison and everyone else involved in planning low-income housing or affordable housing of any kind, that seniors cannot be forgotten in that mission. We're starting to see, housing options for homeless. We're seeing housing options for veterans. We're seeing housing, but we're not seeing specific housing options for older adults. And that's where we're going to need to make progress on advocacy, that this is a significant need for older adults. So we've already got that started, that relationship started, and we're progressing there. And then finally, under the caregiver goals, We have already had orientation, 2 orientations, inviting key stakeholders to become part of that advisory council, to be the group that is going to work towards making relative caregivers a real option here in Dane County in terms of paying for relative caregivers to provide care to our older adults, which is particularly important in families of color. They don't want an agency or a stranger. They want someone they know, someone like them, to be able to come in and feel comfortable caring for their older adults so that they can leave and relieve their stress and burden. So that has already been established, the advisory council, which will begin this work in February. So many of the areas we've also started recruiting the Latinx leaders to be trained in stepping on the high-level evidence-based classes. So much of what we have put forth, we have already begun the work to make sure that we go right from the get-go and make things happen.
Great. Does anyone else have any comments, questions?
Yeah, Cheryl, this is Paul Yoakum calling.
Hi, Paul. How are you?
I'm doing pretty good. Liking the warmer weather in December, if you can believe it.
Yes. Paul Yoakum, for some of you who don't know, is the ADRC governing board chair. And thank you for joining us today, Paul.
Yeah, well, I'm on today as a senior, and then as Cheryl mentioned, one of my other roles is the chair of the ADRC in Dane County. And I just want to say, I want to recognize, like other people have done already, the tremendous amount of work that went into developing this plan. And I know this happens every year, but I think we have to continue to reward that and say it out loud so people hear it. So that's number one. And then number two, thanks for the emphasis on caregivers. As most of you probably already know, we're in the midst of a severe caregiver shortage, and part of it is due to COVID. Part of it's due to low wages. There are other number of other factors involved, but we simply have to do something about it. And so I appreciate the reference about caregivers. One of the things that the ADRC board did yesterday was agree to emphasize the caregiver shortage and try to develop a way or ways to develop some type of an action plan to do something about it. We've got a lot of information about it, and the statewide task force that the governor put together brought to our attention a number of recommendations, but we've got to get those recommendations acted upon. So one of the other things I wanted to add to today is that I'm also a member of the new advocacy group, Wisconsin Seniors Advocates, formerly was Seniors in Charge.
Right.
But I'm also a member of one. That group, the number one concern, and it's made up of senior advocates, the number one concern is caregiver shortage and the things that we need to do to help fix that problem. So going forward, I just want to thank you for working with all to eliminate the caregiver shortage and the wage discrepancy.
Thank you, Paul. And thank you once again for serving on the ADRC board. And yeah, caregiving is a big topic and a very large concern. I think everyone in the room here, probably in the room, virtual room, is either a caregiver now or you will be one in the future. So yeah, shortage of staffing is very concerning. But I think we're all in this together, and we just need to keep continuing to put attention on to this need. So. Anyone else want to add anything? You can raise your hand. You can put it in the chat room. Or you can just wave your hand at me. Give me a wink.
So we did just have a couple of people who signed on, so I was just letting
Okay.
them kind of get.
Okay, well, welcome everyone. I'm glad that you were able to attend. We're at the tail end of the presentation. Just trying to get, give an opportunity for people to make comments or ask questions about the plan or provide any recommendations. If you instead want to put it in writing rather than talk about it here, you can certainly email or you can write us a letter. And our email is AAA@countyofdane.com. Cindy, can you put that in the chat room, please? And then could you also put our address in it? So. Okay. Anybody else have any questions or comments? Okay, well, I don't want to use up everybody's time. I know it's lunch hour at my house too, so I would like to say thank you to for you all for joining us. I'd like to particularly thank Angela, who's been my Girl Friday, is a term that just keeps coming back. This is a very big undertaking, and I couldn't have done it without her. I totally appreciate the support that the board has given us, particularly with Supervisor Radcliffe. And I would be remiss if I didn't point out that my boss, Todd Campbell, has joined us. He's the suave and debonair young man with the tie and the white shirt. And he provides constant guidance to me and to everyone within our division. So thank you very much. Okay, Richard, do you still have a question or is your hand still raised? Oh, and you're muted, Richard. Richard, you're muted.
Thank you. Yeah, Cheryl, I just have a comment after listening to what your group is doing. You have a substantial challenge ahead of you. My volunteering experience goes back many years, about 30 years. And I know what it takes for volunteers to take the time necessary, and especially with the challenges that we have today. So your boss, Todd, and your staff has to be commended by me. I see the efforts coming from your organization in what I do volunteering. And I just thank everyone who has attended today. I fully believe that you people are so important to the lives of other people out there. And I just wanted to comment and pass that thanks on to everybody.
Thank you, Richard. Okay, I don't see anybody else's hand up. I don't see any more comments in the chat room. Thank you to everyone who's been putting comments in the chat. There's just comments, there's no questions. So I'd like to end this meeting by reminding everyone that while we're here, in the middle of a pandemic, we have worked hard to ensure our older adults remain living independently and safely in their own homes. And we do this through ensuring that they get vaccinations and boosters. We've been working hard to ensure that they get food, And we're also very much interested in social isolation and ensuring that our older adults are fighting the challenges associated with that. So thank you so much for being with us, for continuing to support our efforts. And I applaud you all for helping our older adults live in Dane County. Thank you. Bye-bye.